Hello everybody, I am Dr. Vandana Narula, Senior IVF Consultant at Motherhood Fertility and IVF Centre, Chandigarh. What causes male infertility? The diagnosis and the tests. What is basically required for fertilization? Egg from the female and sperm from the male partner. And when the fertilization occurs naturally inside the female body, that is the fallopian tube, the embryo formation occurs, and when implantation occurs, there is a positive pregnancy. And if anywhere this fails to happen, there is infertility problem. Now talking about sperms, where are the sperms produced? Sperms are produced in the testes. So in some cases, when we encounter male infertility problem, the testes are unable to produce sperms. There might be hormonal problems. For testing, what we do is we do a testosterone test for the patient. If the sperms are not produced, the semen analysis will show azoospermia. Further testing is required for azoospermia because it might also result due to ejaculatory duct blockage. So whenever there is a sperm production, if sperm production doesn't occur, then also the resultant semen will show 0 sperms. If the sperms are being produced in the testes normally and they are unable to come out through the ejaculatory duct and unable to deposit themselves here, naturally pregnancy is unable to occur. So if there is a blockage in the ejaculatory duct, if there is ejaculatory duct dysfunction, then by FNAC, they will be able to see sperms from the testes but not be able to see the sperms in the normal semen sample which we see under the microscope. There might also be other defects in the human, in the male partner, like he might be having erection trouble, so there might be a sexual dysfunction, they might not be able to form a relationship that will be the cause of infertility. And also there might be ejaculatory dysfunction like retrograde ejaculation, when normally the sperms they go back into the urinary tract. That all is diagnosed by a general physical examination and by semen analysis and also a ultrasound. Whenever the semen analysis is done, this is the first and the foremost and the main test which is done for the diagnosis of male infertility problem. It is done in the andrology lab. We see different kinds of pictures in the sperm counts, sperm motility and sperm morphology. All three of these are important when fertilization is to be considered naturally, and even when we do in assisted reproductive techniques for IVF and ICSI. So I would just like to conclude that when it comes to male infertility testing and diagnosis, the first and foremost test is the semen analysis test, and if there is some problem in the semen analysis, physical examination of the male is done. Then other tests which are required, they might be like ultrasound, scrotal ultrasound, then genetic testing or hormonal testing is done, and we further come upon the diagnosis is confirmed and the treatment is offered accordingly to the couple. Thank you.